Hello there, welcome to Shine Tech's YouTube channel. In this video I'm going to talk about the gross anatomy of the scalp. So by the end of this video you must be able to describe the layers of the scalp, blood supply of the scalp, venous drainage, lymphatic drainage, innervation and clinical correlations of the scalp. Before we continue, don't forget to like, subscribe and leave your comment in the comment section below. So the term scalp refers to the soft tissue covering the skull, and it extends from anteriorly to the superciliary arch and posteriorly to the superior nuchal line, and laterally on each side it extends to superior temporal line. Okay, so this is the area of the scalp. It extends from the superciliary arch just above the orbital, and then from there laterally it is from the superior temporal line, and posteriorly it is from the superior nuchal line. Okay, so those are the borders of the scalp, but in other books you are going to find that it extends up to the zygomatic arch. Okay, so now let's look at the layers of the scalp. So we have 5 layers of the scalp. To name them, they are named after the name scalp. So S is for skin, C connective tissue, A aponeurotic layer, L loose areolar tissue, and P pericranium. Okay, so we're going to look at what constitutes all these layers one at a time. So let's start by looking at the skin. So these are the same layers. We have the skin, which is the outer layer, followed by the connective tissue, which is this layer here, and we have the aponeurotic layer, which is this layer in green color, followed by the loose areolar tissue, and finally the pericranium. Okay, so the skin. So the skin, as you have already seen in that diagram, it is the outer layer of the scalp, and it contains many sweaty and sebaceous glands and hair follicles. Then from there, it is thick except over the forehead. So the skin layer is thick except over the forehead. Okay, now let's move on to the connective tissue. So the connective tissue, it connects the skin to the aponeurotic layer, and then from there the connective tissue is rich in blood vessels and nerves that lie in this layer. Okay, so we have blood vessels and nerves that lie in this layer. And another thing to note here is that it is thick and dense. Okay, and it is well supplied by the cutaneous nerves. So that's all about the connective tissue. Okay, so the third layer is the aponeurotic layer. So the aponeurotic layer, it contains the epicranius muscle and its aponeurosis. So the epicranius muscle is simply the occipitofrontalis muscle, okay, and its bellies. Okay, so it is in the aponeurotic layer. Okay, so on this diagram we have the skin followed by the connective tissue, aponeurotic layer, which is the third layer. So this layer is, that's where we are going to find the occipitofrontalis muscle and its aponeurosis. Okay, so the fourth layer is the loose areolar tissue. Okay, so the loose areolar tissue is simply a sponge-like layer with potential spaces, and it is made up of loose areolar tissue itself. Then from there, this layer is also considered to be a dangerous layer of the scalp. Why? because in this layer, if at all there is an infection of the scalp, there are going to be collection of pus, okay, and that pus which is collected in the areolar tissue can flow in what we call the emissary vein to the venous sinuses, which can lead to thrombosis there, blockage of certain vessels, and that can result in stroke and other fatal diseases. Okay, now this loose areolar tissue allows movement of the scalp. Okay, it allows the movement of the scalp proper. So when you say scalp proper, what we mean is that the scalp proper is simply the first three layers which we have mentioned. Okay, those layers are tightly, firmly attached, but now the loose areolar tissue, it allows free movement of those three layers, which are the skin, the connective tissue, and the aponeurotic layer. Okay, those are tightly attached and they can move freely over the loose areolar tissue. So the loose areolar tissue is the one which allows free movement of the scalp proper. Okay, so the last layer, which is the pericranium, this one is simply a dense layer of connective tissue that forms the periosteum of the neurocranium. So the skull is divided into two. We have the neurocranium and the visceral cranium. So the layer of the pericranium covers it forms the periosteum of the neurocranium, okay, which is part of the skull. Okay, so that's about the layer of the skull. Now let's move on to the blood supply to the scalp. So the arterial supply to the scalp, so it is supplied by 5 arteries on each side of the midline. Okay, so the 5 arteries are there. We have the supratrochlear artery. Okay, then from there we also have the supraorbital artery. Okay, so this one here is the supraorbital artery. So now these arteries, we have 3 arteries in front of the auricle, and we have 2 arteries behind the auricle. So now the 3 arteries in front of the auricle are the supratrochlear artery, also have the supraorbital artery, and then from there we have the superficial temporal artery, which is this artery there. Then from there, behind the auricle, we have 2 arteries, which are the posterior auricular artery and the occipital artery. So that is the arterial supply to the scalp. Okay, so they are divided in the midline here. So the same arteries which are here are the same arteries which are this side. The venous drainage. So the venous drainage of the scalp is also similar to arterial supply. Okay, so it is drained by 5 veins, which are there. We have the first one, which is the supratrochlear vein. Okay, so from supratrochlear vein we have the supraorbital vein. Okay, after that we have superficial temporal vein, and we have the occipital vein. Okay, so those are the 5 veins. And the posterior, we have the posterior auricular vein. Okay, superficial temporal vein, occipital vein. We have the supraorbital vein and supratrochlear vein. Okay, so those are the 5 veins. Now let's see where they drain and what they form. Okay, so supraorbital vein will join the supratrochlear vein and form what we call the angular vein. Then the angular vein, we are going to have a nasal vein coming from the nose, joining it, and from there it is going to form the facial vein. Facial vein is going to drain into what we call the internal jugular vein. That internal jugular vein there. Then from there, the superficial temporal vein is going to also join with the other vein, which is the maxillary vein, to form what we call the lateral mandibular vein. The lateral mandibular vein, which is going to bifurcate here and form the posterior and anterior branch. Then the anterior branch is going to join with the facial vein here to form what we call the common facial vein, which is going to drain into the internal jugular vein. Then from there, the posterior branch of the lateral mandibular vein is going to drain into the external jugular vein. Also have the posterior auricular vein also drains into the external jugular vein. So that is the venous drainage of the scalp. Now let's move on to the lymphatic drainage. So the lymphatic drainage, the lymph of the scalp is drained by the preocular lymph nodes. So the preocular lymph nodes are also called superficial parotid lymph nodes, then which is this lymph node here. Okay, then from there we also have the posterior auricular and occipital lymph nodes. So the posterior auricular is simply posterior to the auricle, that lymph node there, and we also have the occipital lymph node here, just at the occipital bone. Okay, so all these lymph nodes are going to drain into the deep cervical lymph nodes. So that is the lymphatic drainage of the scalp. Okay, so we are done with the layers of the scalp: blood supply, venous drainage, lymphatic. Now let's move on to innervation. So innervation of the scalp. So it has sensory and motor supply. So the sensory nerves, there are 8. Okay, there are 8 sensory nerves, which are the supratrochlear. Okay, so we have 4 in front of the auricle, and we also have 4 behind the auricle. So the 4 which are in front of the auricle, we have the supratrochlear, supraorbital, zygomatico-temporal nerve, and we also have the auriculotemporal nerve. And then from there, behind the auricle, we have the great auricular nerve, which is originating from C2 and C3. Have the lesser occipital, the greater occipital, and the third occipital, which is coming from C3. So those are the sensory nerves of the scalp. Now, talking about the motor supply. So the scalp is supplied by the temporal branch of the facial nerve and also the posterior auricular nerve. Okay, it is also the branch of the facial nerve. Okay, so these nerves, the temporal branch of facial nerve is going to innervate the frontal belly of the occipitofrontalis muscle. Okay, and this one is going to innervate the occipital belly of the occipitofrontalis muscle. That is the motor supply of the scalp. Clinical colorations. Okay, so on the clinical colorations, the first one is the black eye. So black eye is simply the discoloration of the skin around the eyes. So this one comes about when blood and fluid, okay, collect in the layer, which is called the loose areolar tissue, the layer which we have just talked about. Now that comes as a result of a blow or injury to the head. Okay, since we know that the areolar tissue is the one which makes the scalp proper to move freely, and we know that the loose areolar tissue is sponge like, so there will be accumulation of blood. Okay, and that blood can flow to the eyelids. Okay, so accumulation of blood in the eyelids, and we know that those muscles, the occipitofrontalis muscle, has no attachment to the bone of the scalp. Okay, so we are going to have accumulation of blood in the eyelids, which will lead to black eye. Okay, discoloration of the skin around the eyes. The second one is the dangerous area of the scalp. So the dangerous area is the same layer I'm from talking about, which is the loose areolar tissue. Okay, so this the loose areolar tissue, there we can have blood and pus collecting in that layer. Okay, so once pus and blood collect in that layer, that can result into an infection, and that infection can travel along the emissary vein. So emissary vein is the vein which now drains into the venous, the durovenous sinuses, okay, leading to thrombosis. Okay, that is the dangerous area of the scalp. So another clinical correlation we can talk about is the symphylohematoma, which results as difficulties in delivering, vaginal delivery, when the baby is being delivered. Okay, so that hematoma comes as a result of rupture or breakage of some of the scalp cartilages, which result in accumulation of blood in the pericranium layer of the scalp, and that is what we call the symphylohematoma. Okay, so thank you so much for watching. Don't forget to subscribe and leave your comment concerning this video in the comment section below.